Hello, everyone. Welcome to today's webinar hosted by the American Public Human Services Association, or APHSA, in partnership with Augintel. Today's webinar is titled Using Unstructured Data to Assess Adherence to Practice. Next slide, please. My name is Alex Claremont, and I'm the Senior Content Writer here at APHSA. Well, I'd like to take a moment to share with everyone an overview of APHSA and the work we do for and with our members. APHSA is a membership organization that represents state and local human services agencies from across the country through their top-level leadership. We're a bipartisan organization focused on building common ground. Next slide, please. APHSA aims to deliver for our members through three core channels: influencing modern policies and practices with the goal of strengthening communities, building capacity through our conferences, technical expertise, publications, and organizational effectiveness consulting practice, and three, and connecting members with key partners. Did I say three twice? Speaking of connecting members, I invite each of you to save the date for the APHSA. Next slide, please. Speaking of connecting members, I invite each of you to save the date for the APHSA National Human Services Summit's Call for Proposals. The summit will take place between the 14th and 17th of June, and we're inviting all of you to share your ideas for progress and innovation with human services leaders from across the country. To have your voice heard, follow the link on your screen and send your submissions before Friday, February 13th. Next slide, please. I'd also like to recommend that attendees pay a visit to the APHSA Career Center. The goal of our Career Center is to connect top talent with amazing opportunities. Recruiters get personalized support and access to a large niche group of human services professionals. Job seekers can discover positions that align with their goals within the sector. Be sure to follow the link on screen and visit our Career Center today. Before we begin, I'd like to set some light housekeeping rules. During the presentation, we request that you place your questions for our presenters in the Q&A panel rather than the typical Zoom chat feature. If possible, panelists will try to answer questions during the presentation, but there should also be time left at the end for questions. Lastly, this webinar is being recorded, and it will be shared with all registrants in the coming days. Next slide, please. Now it is my pleasure to introduce the CEO of Augintel, Marty Ilesko.
Thank you. Welcome, everybody, and thank you for joining us today. I'm Marty Ilesko, CEO of Augintel, and on behalf of APHSA, Illinois DCFS, Chapin Hall, and our team, I'm really pleased to welcome you to today's conversation using unstructured data to assess adherence to practice. Next slide, please. For a long time in child welfare, we've relied primarily on structured data, checkboxes, drop-downs, and compliance fields to understand what's happening in practice. Next slide, please. But as we all know, the real story of families, youth, and frontline work lives in narrative, in case notes, assessments, and written observations. Until recently, that narrative was largely inaccessible at scale. Next slide, please. Today, that's no longer the case. Advances in artificial intelligence and natural language processing are making it possible to responsibly analyze narrative data across an entire agency, not to police practice, but to better understand it, support it, and learn from it. And that's exactly what we're here to explore together. This discussion will be in two parts. In the first part, we're going to learn about AI that's widely used at Illinois DCFS today and is proven in practice. In the second part, we will learn an example of where DCFS plans to take AI in the future. Next slide, please. We're incredibly fortunate to have with us leaders who are actively shaping this work in the field. Brian Doherty is the Chief Counsel at Illinois DCFS, and he will share with us how access to narrative data is already changing how DCFS thinks about practice, staff safety, supervision, compliance, audits, and investigations. We're going to learn how DCFS is using NLP today in their day-to-day delivery of services by both frontline staff and agency leadership, how it gives staff what they need to make data-informed decisions, and the impact it's bringing to the agency as a whole and the children and families they care for. We will see how AI has been proven in the field. We will also learn how this is a very different approach to what you may hear about in other industries, where AI is used to form conclusions or make decisions, actions we know must remain with child welfare staff. Then we'll jump into the future, where DCFS plans to take AI. We're joined by Latanya Riggs, Implementation Director with the Illinois DCFS Office of Research and Child Wellbeing, and Christine Creevy, Senior Researcher at Chapin Hall. Latanya and Christine will talk about the research partnership between Chapin Hall, Illinois DCFS, and Augintel, and the exciting work underway to explore how narrative data can surface evidence of practice, such as with motivational interviewing, and open new possibilities for learning and improvement. This is a panel-style conversation. Our goal is to connect the dots across policy, practice, research, and technology, and share what's being learned, what's working, what's hard to accomplish, and what this could mean for the future of child welfare. As you listen, please feel free to jump in and type questions into the chat, and we'll have a Q&A at the end. With that, let's get going. Next slide, please. First, we're going to start with the polling question about narrative data. You'll see a Zoom window pop up where you can provide your answers. Please click on the answer when it appears on the screen. And here's the question. Which of these matters most, but is hardest to measure at scale? We'll give you a little bit of time to complete this. Have we received the answers? All right, here we go. So it looks like all of the above is the winner with 57%. And it's spread relatively evenly across all of the other areas. So we'll get to this throughout the discussion as to how these are applied with natural language processing and artificial intelligence. But let's go ahead and keep on going with the meeting. Now I'm going to hand it over to Brian Doherty, the Chief Counsel at Illinois DCFS, for the first part of our discussion, who's going to talk about how DCFS is using AI and NLP today.
Thank you so much, Marty. As Marty said, I'm Brian Doherty. I'm the General Counsel for Illinois DCFS, which is a statewide child welfare agency. If you could go to the next slide, David. I should start by saying that, the way Marty just talked about it is right and is smarter. But I do want to say that we at DCFS really talk about the work of Augintel and sort of natural language processing in a very different way. And I think it's probably because we're a bunch of social workers and the occasional lawyer. But to us, we really view it more basically as just an incredible tool to help us accomplish our objectives, to communicate with the field, and to make sure we're meeting our legal obligations. So really, if there's one takeaway I can convey today, is that this is a means, unlocking narrative data really to us means just a way to improve our practice and improve our compliance with our legal obligations. So it's something we use to meet the unmet needs of both our staff and the people we serve. David, if you could go to the next slide. There's a lot on this slide, but I will just ask that you look through it for the purposes of the Q&A to come, but this is all of the work, or a fairly comprehensive representation of all of the work that Augintel and Illinois DCFS do together. And it's something that has grown over time as we've realized how effective this is at getting to the root of some of our most challenging problems. The bolded ones in the sub-bullet points I want to be talking about in more detail over the next few slides, but I do just want to hit on a few of these from a high level, just so you get a sense of how we are bucketing their work and how we're using it to sort of execute on our job on a day-to-day basis. Safety is a great example, both from the perspective of worker safety and then child safety. Augintel, by crawling through our entire narrative data across all of our 17,000 cases across the state, has helped us answer questions and has helped leadership be more accountable to the staff by being able to tell them prospectively, for example, whether or not a case involves domestic violence and whether or not there's an order of protection in place. Leadership is then equipped to sort of proactively communicate with staff about issues that they need to be aware of going into that new case or going into that new home. On the other side of the coin, you have something like child safety, where we want to know, leadership wants to know, if children are being interviewed according to our procedure, which is separate from the caregiver, to make sure that private child interviews are happening and that we are sort of complying with our rule and legal obligation. Permanency is another good one. Like, we know, if you're in child welfare, that if there's a disruption in placement, it's very hard to unwind that. It's very costly to fix that. If there are ways that we can get notice that we're seeing problems in a placement ahead of time, that allows us to invest resources in a way and wrap around that family before you're past what is often a catastrophic and irreparable event with that placement. So those are just a few examples of the way our system of record, as it's currently designed, there's not a checkbox, as Marty said, for certain things, definitely not like the precursors to placement disruptions, that we can get access to quickly using this tool. Documentation is another one that I just want to touch on briefly before we go into details of the other ones. Is there are 1,000 caseworkers entering notes across the state. There's 15,000, 17,000 kids in care at any given time. It's not always the case that the supervisor is paying attention to every case note, making sure it's compliant with procedure, making sure it's really accurately telling the story of that family. Augintel has helped us, crawl through, evaluate all the case notes so we can elevate it to leadership. And so leadership can get to the supervisor and the supervisor can get to caseworkers if the notes are insufficient, if they're too short, if they're duplicative. And this is a point I want to make loud and clear right from the beginning, is this isn't just some email that comes to DCFS leadership and sits in their inbox. The system is designed in a way to sort of contemporaneously make it clear to the field, to the supervisor, that we're seeing these issues in the record, and it goes right to them so they can address it contemporaneously. So there's about 20 different ongoing and active monthly, if not more frequent, ways that this system sort of watching what matters to DCFS leadership, and then we're able to really get it out to the field in an automated way to make sure our priorities are advancing. But there's also these one-off cases that things come up. You have a litigation, you have an audit issue. There's these deep dives that we need as an agency that in some circumstances you're going to have to go to a university partner, or it's going to be too costly of a dive to really take. Augintel can help with this. Like, we had a situation where we really wanted to know deeply about how social media is playing a role in our kids' lives and how social media is coming up in our cases. So they were able to help us across every single case going back. Marty, tell me how many years we're able to pull out every mention of social media and really start to analyze it and digest it and see what it correlates to. So really,
About 10 years, yeah.
go ahead, Marty.
About 10 years.
Yeah, so an incredible look back on every time, any sort of social media reference was mentioned. So we could really start to understand how and what and why social media plays a role in our kids' lives. So a very, very useful look at unstructured narrative data. Next slide. Okay, here's a more specific one. We were faced with a concern that in the intact setting, we were not bringing all of our resources to bear for expected mothers. We didn't know how to ensure that leadership was providing the appropriate support to the field in these sort of high risk cases where you really needed some focused attention, some elevated attention. Augintel really helped us dig in to understand every single case out there where there is an expectant mother with an intact case. And that allowed leadership to really provide the support because the field was doing a great job, but we wanted to know that we were prospectively getting to the field to make sure that they had access to the resources that we had and that were potentially being underutilized. So the end result of that was significant that I think we discovered about 600 cases that we really were able to focus in on and provide resources to. Next slide.
And I'll add one thing, Brian, that also gets to, the topic of being able to maximize the resources available to children and families, right? These are resources that you have within your organization that sometimes can go underutilized because you're not aware of all the individuals that have that unmet need. So this allows the connection of individuals with unmet needs to the services that are already available to them. And it bridges that gap in a pretty seamless way.
Yeah, and that's right in line with the hearing and vision loss, which we'll
Mhm.
cover in the next slide. But this one, child and family team meetings, part of our core practice model in Illinois is that these happen uh, quarterly and that they happen in a way that we're meeting the fidelity standards as set out procedure about what they're supposed to look like. No, we determined that we just weren't happy with the way we were really looking back at whether or not these happened at the time with the frequency and in the quality that we expected them to. It was really, by the time we realized there was an issue, it was months past when they should have occurred. Augintel has helped us in the moment understand when there has been too much time passing, and we've been able to use sort of notice and communication once that's triggered to get a message to the field that these need to happen. These need to happen. They need to happen in this form. Part of our core practice model is child and family team meetings, but it's also the precursor to that is child and family teaming or creating a team that is really effective. So this not only helped us more contemporaneously make sure these are happening, but making sure they're happening in the way that they should. Another big success to this approach. Next
Hey,
slide.
Brian, I'll just pause you. There's a question in the window that I'm going to read from Jamie Carter. The question is, are you using natural language processing to generate features that are then used in predictive modeling? Or is the modeling framework an unstructured analysis that identifies clusters of mothers, for example, who might need help given narrative inputs? So the answer is the latter. What the software is doing is reading through every single case note for language that seems to indicate that there is an expectant mother involved in this case. And then it literally surfaces that case to the caseworker or the supervisor or the people running that program so that they can be aware that that person, that is an expectant mother and they can use that list and reach out to them.
Exactly. right? No, we're being very conscientious of the fact that we do not want to take the human intelligence part out of child welfare. Like this is really just filling a substantial gap in, and we all have them, older systems of record where there may just not be a clear place where we can run a report that shows you all intact cases for all expectant mothers, where
Mhm.
this sort of fills that gap in a really sophisticated way, but gets us the information and fills the holes and the failings of our current systems. Okay, next slide, please. So this is similar to the expectant mother and is really about unmet need, but we had concerns from our statewide disability coordinator that we really weren't bringing to bear like some very effective and available resources around hearing loss and vision loss. What Augintel did, just like in the expected mother situation, it combed through our data and it was able to identify the circumstances where this was an issue or potential issue. And what that allowed us to do, again, as a support feature to the field, we were able to take that information, identify potential needs, identify potential resources, and provide them and offer them to the caseworker as something to support them. And really, we saw some significant success in this, identifying a large group, following up, and providing support to the casework team, who we all know is very busy, has a lot of demands on their time, has a lot of legal obligations, and this was a effective tool for leadership to provide a supportive role. Next slide. And this is my last slide, but this one is very interesting because it's more about accountability and communication and optics. We had a problem where we got some initial audit findings that, according to the team, weren't reflective of what we believed was happening in the field on the ground. The background is that, we have a mandate to see a child within 24 hours after receiving a report of abuse and neglect. To meet that mandate, you need to do two things. You either need to see the youth in person or make a good faith attempt. What we were seeing in those initial audit findings was that all the data was the reports from our systems of record was blowing back to us and to the auditor was just the contacts. What it did not reflect was the good faith efforts, which are sufficient to meet the mandate, because of course there are circumstances where you try to meet the child and can't for reasons completely outside of DCFS control. So this was about going through those targeted cases, helping us understand when there was in fact a good faith effort, so we could work hand in hand with the auditor to make sure the truth of the efforts we were undertaking was getting to the auditor. So again, another sort of substantial one-off success, getting sort of external stakeholders the information they need about the work that we do.
I'll
So
add, we hear this in DCFS frequently, right? Giving credit to the hard work of caseworkers, it sometimes goes unnoticed. This is a great example of using technology to show that their work has been done. And Illinois went from not surpassing the audit to wonderfully surpassing the audit because of this work.
thanks, Marty. And I think that's it for me. If you want to transition to Latanya and Christine.
Well, there's one question in the chat that I'll cover from Sandra Slappy Brown saying, how do you train Augintel what to look for in each of these situations? So this is a unique thing to Augintel, which is we've built what we think is the only child welfare specific language model. And we've built it from an open source platform trained on your data to understand how you as an organization document these actions, these risks, these strengths, these events, et cetera, et cetera. So it then searches the data for those instances. So it's not looking for, in here we're talking about good faith efforts to visit with kids. It's not just looking for the word good faith effort. It's looking for any indication that seems to relate to that or to seem to be contextually similar to that, and then surfaces that information to leadership, to frontline staff, to supervisors, et cetera, et cetera. Wonderful. All right, we can go on to the next slide. Thank you, Brian. Now we'll transition to discussing how DCFS is examining the use of AI for future applications. DCFS Implementation Director Latanya Riggs and Chapin Hall Senior Researcher Christine McCreevy will discuss how DCFS, Chapin, and Augintel are collaborating to use AI to support the delivery of motivational interviewing, an evidence-based program that's widely adopted across the U.S. So I'll hand it over to both of you. We can
Thank
go to
you,
the next slide
Marty.
too.
Great, thank you. So welcome everyone. We're so excited to be here with you. Thank you, Marty, and the folks at APHSA for inviting Latanya and I to share the collaborative work we're doing. And so we just wanted to highlight, we wanted to start out by highlighting what we think is a really innovative collaboration and one that we really, really enjoy. So, our role as partners is to provide data and technology that support a continuous quality improvement process. Specifically, here, what we'll be talking about today is that CQI process is focused around motivational interviewing practice, which Latanya will share a little bit about how the department is using motivational interviewing. So, as Chapin Hall and Augintel partnering with DCFS, it's the goal of both of our organizations and all three of us working together to see a more supported, prepared, and confident workforce when it comes to their motivational interviewing skill utilization, and then subsequently better outcomes for children, youth, and families. And so we kind of, group our goals into these three broad areas here on the slide: motivational interviewing practice support, overall system improvement, and then ultimately positive change for families. Next slide, please.
So when we think about motivational interviewing, what you will see is we have the definition on the screen. But I do want to give you a little summary of what MI is, and that's what we affectionately call it MI. It's a collaborative, family-centered style communication, right? Focused on being with people and not doing to them. It's acting as a guide, like walking alongside families to evoke their own internal motivation for change and respecting their autonomy and expertise rather than imposing our own solutions. Next slide. So when we talk about motivational interviewing, we actually began implementation in the state of Illinois back in 2021. Alongside that, we chose the fidelity tool known as the Motivational Interviewing Competency Assessment Tool. And it is the fidelity tool that we're using to measure our strengths and our areas of improvement in our use and understanding of motivational interviewing. So currently, we're in the initial implementation stage of implementing this tool across the state of Illinois. We're starting with our Division of Child Protection. So that's one thing that we're doing to monitor and improve MI practice within our workforce. The second thing we're doing is we have quality implementation reports. We love reports, okay? So each quarter we receive this report from our partners at Chapin Hall. These reports help us to see our use of MI when working with families. They provide us with a quantitative dive into workforce MI training status. So we need to know who's been trained within motivational interviewing throughout the state and who has not been trained. Also, motivational interviewing techniques and documentation patterns and case notes, as well as MI usage according to case notes. Most common used MI techniques documented in case notes as well, just to name a few. And I'm going to pass it back over to Christine to talk about the supplemental narrative case note data analysis.
Thanks, Latanya. So, as a continuous quality improvement partner of Latanya and the DCFS team, it's a privilege to me and a joy, but I don't know if everyone would feel this way. But I get to spend a lot of time looking at the department's data, wondering, is there more we can pull from it? Or can we look at it differently to learn about practice, learn something new about practice in order to utilize that newfound knowledge in improvement cycles, right? My goal as a data and continuous quality improvement partner is not just to get more data, it's to use that data to support caseworkers, supervisors and their teams, like I said, ultimately to get us to better outcomes for our children and families. Um, and as you'll know, if you are doing or engaging in continuous quality improvement with any program or practice, there are sort of categories of data that you would be interested in learning about. So we want to know things like, is the program being delivered to the people it's intended for? Is it reaching them, right? Because if it's not reaching them, they're not going to get the benefits of the program. That's always number one. Number two is the fidelity. Because if a model or a practice has been studied by research or even just developed and kind of understood to have key components that make it that specific program, we want to make sure that we are implementing it in such a way that is adherent to the way the program was designed to work. And if it was research in a way that we know it does work and has positive effects. And then we're also, of course, interested in, is it having the effect we hoped it would have? And so as Latanya mentioned, one of the department's selected tool for fidelity, that sort of adherence to the practice, are we doing motivational interviewing in the way that we hope to be doing it, is the MICA, the Motivational Interviewing Competency Assessment. And this is what I would call your sort of traditional fidelity tool. It is you do get both quantitative and qualitative information from it, but it is resource intensive. It is observation based. So the way you assess a caseworker's fidelity is by having a coder, a rater, observe a session with a single caseworker. They go through a simulated interaction with a family and take note and ultimately complete a rating scale for the degree to which that caseworker is showing particular skill in a number of motivational interviewing techniques and competencies. And so while rigorous, right, that sort of type of fidelity measurement really can only offer realistically a small glimpse into practice at any given time. Especially when you were talking about a practice that is a statewide practice that is intended to be delivered by all of Illinois DCFS and contracted provider partner staff. So we're looking at roughly 3,000 staff delivering this in any given quarter to what did I jot down here? To many families. Over in our last quarterly report, we documented 200,000 case notes that were entered in a quarter. So that is a lot of interactions with families during which caseworkers are trying to engage families using motivational interviewing. Needless to say, using that one-on-one observation and rating their skills is just not feasible at that scale to get a sense of statewide practice with all families across all visits, right? It just isn't. And so I'm always thinking about this. Is there a better way that we can measure and understand what's going on in practice? And so, like I said, I spent a lot of time looking at the ways Illinois has to collect data, one of which is the case note. And while there is a box in that case note for the caseworker to say, I utilized motivational interviewing during this interaction with the family, that doesn't give us insight into what aspects of motivational interviewing were used, how it was delivered, what, in what context. And so this is when I started to really think about that big box in a case note that is ripe for caseworkers to document their case, their visits with families, right? And lo and behold, the department was already working with Augintel on using that case note narrative, like you heard Brian explain in the first portion of today's webinar. But they weren't doing it yet for motivational interviewing. So if we go to the next slide, I'll spend a minute here talking about where we are in terms of motivational interviewing practice and using Augintel's capability to support that process of continuous quality improvement. I do want to mention sort of upfront that I'll refer to the LLM is the large language model. It's the model of natural language processing that we are using. So the model in and of itself is still in development, right? And I would say that is sort of to be expected because it is a very iterative sort of process. And we are working together to build and refine that so we can get it to a place where the output the model returns to us can help us achieve our goals, which are listed here on the screen. So first and foremost, our goal for using and partnering with Augintel and motivational interviewing is to simply get a robust understanding of the workforce's skill and technique utilization when it comes to motivational interviewing techniques. For those of you who are not familiar with motivational interviewing, just listed a couple there, the extent to which workers use open-ended questions to evoke clients' own internal motivation to change. So there are a number of things we just want to see our caseworkers utilizing these skills which they have in their MI toolbox. Second goal then will be taking that to a next step. Once we understand the skills and techniques that are being utilized, we can understand the extent to which they're being utilized and how well they're being utilized, which for us really serves the purpose of skill development, right? We can use that information to take back to the training department and say, hey, we're noticing that the workforce really needs support in evoking client motivation to change when they're experiencing, any number of specific challenges in their life. And they can work that into either their simulations or their skill sessions. And then long term, what we're really excited about, and we hope to get to a place to be able to do, is to say, okay, we have an understanding that caseworkers use this list of MI techniques and skills most often, and what is the family or client's response, right? So what is the direct kind of change that we're seeing in families as a result of the skills that we're now able to pull out and see evidence of? So really, really exciting potential there. And I know we're going to get there with all of them. Next slide, please.
So we talked a little bit earlier about how Augintel is really assisting us with doing a deep dive into the qualitative, data that we need to see how well are we using MI within the state. And we want to show you some examples, but before we do that, we want to take a quick pause right here to talk about the process. As I mentioned earlier, we have the MICA, and we know the MICA gives us quantitative as well as qualitative data, right? It's a role play, so we have the opportunity during a simulated activity to see how staff, meaning supervisors and caseworkers, use their motivational interviewing skills when working with families. However, with Augintel, we not only can see how well they're doing, but we're able to dig deeper into those case notes to actually look at the quality of work that's being done when it comes to their use of motivational interviewing with families, right? it's a process. So while we may want to get things quickly, of course, with a snap of a finger, I mean, it's like, you Google something and it comes straight up, right? We're looking for that. We still have to go through a process together. Augintel, Chapin Hall, and myself, we meet and we go through the things that we've been seeing in the case notes, the things that we've actually seen when we pull data. And we're saying to Augintel, this is what we're seeing. And what we're doing is we're building out Augintel to pull those motivational interviewing notes so we can continue to do the qualitative dive that we need to do. So let's think about it. This is a large language model. And we want to emphasize that even though this is great, we still have to have human involvement, which is why we're all working together, right? We need that human involvement for CQI processes. We need that human involvement so we can continue to skill build as well when you're working with staff. So during this process, we have already learned a lot along the way. During round one, we worked together. We looked at the model. We saw a couple of things that we needed to do differently. We tweaked it. And now it's done. So now in round two, we're working together to ensure that we are able to, this large language model can pull accurate MI skills, techniques, and processes, right? We're there. So now we're getting ready to move into round three, where we're going to bring in a motivational interviewing subject matter expert that's going to help us to get the model into an even greater place, right? So the model is great. I've used it myself to look up notes, and it's really quick, it's fast, it's to the point. And if you're working in the seat of a supervisor or an administrator, what you'll find is that using this large language model is really effective when we look at the quality of the work that we do. But again, it is a process for us to get there. So while we would like for this to have been done yesterday, we're okay with taking the necessary steps to get it to the place of perfection for our state. What we've learned over the years, especially with implementation, we take the PDSA approach, right? That particular model. We plan it, we do, we study, we act. And so what we're currently doing, we plan it out. We're actually doing it now, but we're also studying, right? Which is where our meetings come in at. We're meeting and we're saying, hey, this is what the Augintel pulled. This is great work. Okay, let's go back and see if, we can tweak it a bit so we can pull even more information that we're looking for to ensure that we, as a state, that we're actually using MI according to fidelity. Then now when we get to the act part, that's where the tweaking comes in at, right? We're making those changes. But we're not only doing it with Augintel, because here's what Augintel does for us as a state. And I want to make sure I put this in here just to kind of pin it a bit. It also helps me to see, as a leader on this project, areas of improvement that we may need to make in some of the layers within our own state, whether it's me talking to Chapin Hall about some of the data, whether it's me talking to leaders saying, hey, I think we can use this type of trainer or this type of workshop. So there's more than just putting a keyword into the system. This is a system that's able to make greater changes across the board. Next slide.
Okay. So I really appreciate LaTanya's pause there to explain a little bit about the process and the deeper kind of underpinnings of this work, because as we were, organizing what do we want to share for this webinar, it's always hard because so much work goes into getting to a certain point in a process, right? And with only an hour, we can just skim the surface. So I really appreciate that, LaTanya, especially before we look at some examples of really where we are very much today, real time. So here is an example of some of the initial output of the large language model. It is the goal here is to address that first goal I talked about of understanding which skills, processes, and techniques caseworkers are using and what that looks like in practice, according to what the Augintel model is able to pull out of the narrative portion of a case note. So this example has to do with the MI process of evoking, and I have the definition there. Evoking is where the practitioner, in this case, the caseworker, seeks to increase client change talk and elicit the client's own motivation for change and their confidence in their ability to change. So as you can see on the slide, the LLM initially labeled the following statements here as examples of evoking. let's say Jones. Ms. Jones stated that she feels that she will be able to successfully maintain sobriety after she moves out of a safe haven. That was one example. Another example it labeled was Ms. Smith wishes to gain knowledge and skills from service engagement to help better parent Anika, let's say. The third example there. She feels that this will be better for her and her children as she will have more time with them and she won't be spending her money on gas to drive back and forth. So in our collaborative review of this, we immediately knew that it wasn't quite what we were looking for, right? Our goal being to identify examples of caseworker MI skills, particularly evoking. It would have to be on the part of the caseworker using an MI technique to draw out a client response. And so what we're not seeing here is evidence of that caseworker utilizing a skill. What we're seeing is likely a response to something the caseworker said or did, right? But we can't just assume that and call it motivational interviewing. So we went back and Augintel tweaked the model, and now we're sort of at this next round. If you go to the next slide, David, please. And here, these are two examples of not evoking, in this case, two different MI processes. So the first box is an example of engaging, which is where the caseworker seeks to establish rapport between the client and practitioner. And this time, here is the output that the LLM gave us. The worker built rapport with Ms. Jones and so-and-so and labeled that as engaging. Worker is still working on building a relationship with the child. And bingo. I was so excited when I saw this. I was like, yes, that's it. Because now we have evidence, we've pulled out, right, direct documentation of a caseworker showing an MI process, specifically here, engaging. And note that I love the honesty of that second line. Worker is still working on building a relationship with the child. That is 100% part of the engaging process, right? And so over time then is what's so exciting. We would be able to follow within this case, looking for additional examples of engaging and see if the worker was able to document getting to a point with the child where they have developed rapport with that child as well. A second example here is with another technique, MI technique of affirmation, which is a clinician statement that acknowledges the client's difficulties, efforts, and self-worth. So the sentence that the LLM tagged as an affirmation statement was that the CWS, that's the child welfare specialist, praised Mrs. Jones for her hard work and dedication to make a positive change in her life. Again, direct documentation of the CWS, the specialist, using an affirmation and evidencing MI. So what I was talking about, and it was a question in the Q&A, and we can get into it a little bit more. So Jamie, I just want to acknowledge and thank you for your question. What I'm super excited about here is in the previous example where we were looking for evidence of caseworker MI techniques, but got back family or client member response, we can actually use that as some of the outcome evidence, right? So there are multiple levels of outcomes that you can look at in any sort of continuous quality improvement, cycle or evaluation cycle. And it gets so messy when you think about all of the things that influence a family's life and their behavior change, right? So the most straightforward way to start is by looking at what is this MI skill intended to change? It is intended to bring out the true motivations, feelings, difficulty, ambiguity that a family member is feeling in the moment. And so we can look, right, for evidence here of a caseworker using an MI technique, and then we can look directly in the case note for how the family member responded. So that will be the level of outcomes we start with. Okay, I better be quiet. LaTanya, I think you were going to round us up here before we get into some
Yeah.
conversation.
No, I mean, this is good. We could talk about this all day long, but we don't have all day, but I would love to. I saw a couple questions in the chat about SACWIS and I saw one about fidelity tools. I just wanted to kind of talk about the two, and Christine, I don't know if you want to swing back around with that, but while we use SACWIS in the state of Illinois to locate notes and read notes, Augintel will afford us the opportunity to search the notes a bit quicker in a large or smaller quantity, depending upon whether you would like to search your team or your section or one staff member, right? So also you can go beyond using one trigger word. You may have to put in, one trigger word may be evoking. Well, it's a possibility, as you can see from our examples, the person may not have put in evoking. However, with Augintel will pull notes that we can type in evoking or motivational interviewing, and it will pull every note for that team, section, or person that will show the MI skills, techniques, or the exact wording, right? So it doesn't limit us to just a trigger word. The system has been developed out to pull the information, the examples like you saw today. CWS praise Miss the client's name for her hard work and dedication to make a positive change in her life. The technique that Augintel triggered was affirmation, because it is. So with that, we didn't necessarily see CWS use affirmations to say to Miss, right? So this is what's great about Augintel. Whereas I know with SACWIS, you may have to use a trigger word a lot of times. Well, you do. You have to use a trigger word in order to pull what it is that you're looking for. But Augintel has been developed. The system has been developed to pull not just the trigger word, but the skills and techniques that a lot of times when you read case notes, you will find where the techniques or skills are actually expressed, but the actual label is not there, if that makes sense, right? The MI label. And then when
Yeah.
it comes to oh, go ahead.
Sorry, Latanya, I was just going to supplement but please finish.
Yeah. So when it comes to the fidelity tool, I look at Augintel as alongside with, right? Same thing with MI. We have this fidelity tool and we actually have a simulated activity. So let me talk about why I say, along with or alongside, right? Or being with us. What you will find is that we sit with staff, right? And when it's a live simulated activity where we're actually seeing them use their MI skills. That's one part. When we send this information, this outcome over to the supervisor of that maybe caseworker or over to the administrator who's a supervisor for that supervisor, what we do then is we say, hey, these were the strengths, these were the stretches. Basically, this is the outcome from the MICA, which is the fidelity tool for MI. When we send that information over, that particular supervisor can now go into Augintel to put in motivational interviewing, whatever, they're going to put in, to pull those notes up for that particular person, to do a qualitative dive into their notes, which in turn will help them learn how they need to build out this person's skills when they're working with family. So this is two coming together to do what we needed to do within the state, which is to build the skills of staff. So one side is we had this observation, here you go, this is what happened. The other side is, hey, we see we need to build skills in this area, but with Augintel, you can monitor that, the quality of the work that's being done, and to see that skill being strengthened. I hope that makes sense.
Yep, and my perspective was just to generally talk about SACWIS and its functionality. We have SACWIS too in Illinois, and there's no perfect system of record, right? You don't want it to be overly prescriptive with drop downs and click buttons, because then you lose what is really important. It's the caseworker's human observations about what's going on with the family. It is only until you get into those details, which historically we haven't been able to do in aggregate, that you can really ensure that you're getting all the questions you want answered. Things like the notes are insufficiently short, or someone is copying, pasting them. There's no button for that in SACWIS. There's no report that you can generate to say that these are insufficient notes. That's just one example. But you really need sort of the machine evaluation of the narrative notes to answer the gaps, to fill the gaps. There's no button that lets you sort of quickly correlate for example, social media with certain events in kids' lives. So the Augintel takes SACWIS a step further. The reports that are produced through SACWIS naturally are limited by what is put into SACWIS, what buttons are clicked. It takes this overlay, this tool overlaying the narrative data to really extract answers that SACWIS wasn't designed to answer in the first place.
Mhm. And I'll, build on that answer. Dana had a question in the chat. I work in Missouri, and we also have SACWIS currently, and we're able to pull multiple reports. What I'm hearing the difference is that ML AI in Illinois is able to read narratives and notes and also gather information based on described actions and behaviors of families. Am I understanding this correctly? You are understanding this correctly. So what's going on in the background is that the AI model is reading through every single note and looking for topics that are directly relevant to child welfare, risks, strengths, social determinants, early warning signs, note issues, compliance issues, what's worked, what hasn't, et cetera, et cetera. And it is reading through all the notes to not look for exact keywords of these, but to look for notes that contain these concepts in any way they are described in the English language. So it's like a human is reading these notes, but doing it across every single case for every single topic that you are concerned with. Motivational interviewing and all of the techniques that are a part of that model are something that we're detecting, as well as, whatever risk models you're using, whatever, protective factors models you're using, social determinant models, right? It's looking for this continuously in real time, and the software is delivering those insights to staff across the organization in ways that make it really easy for them to understand.
If I could, Marty, I'd like to add to that too, a little bit of a research perspective, because I found myself also asking, well, okay, so it's reading these at scale, right? And coding and ultimately selecting and pulling out, right? And I know I was not trained as a qualitative researcher, but I have done some of that, and I work with several highly skilled qualitative folks. And this is a conversation we're having and should continue to have, right? Um, because the whole purpose of a qualitative researcher's work is to look at narrative data and pull the story from it, right? And I think where we're connecting dots and where there is no reason, not a reason to fear, right, is qualitative researchers and researchers in general are still involved. And that's what I think this partnership is such a beautiful example of, because we are all right there at the table, working together to program the LLM and prompt it to return to us what we are looking for. And if it doesn't get it, we're not going to just accept that, right? And we're also like, I will say it's exploratory. It's pushing. It's innovative because we don't know the extent of what we can get it to tell us, right? And what we can get it to return. So I mean, which I find really exciting. And if you're willing to kind of be there for that, I think the return potential is great, because then traditionally what only one or two, qualitative coders could do, they will be involved, but now we can kind of get this at scale, whereas we wouldn't have been able to review the millions of case notes, right? To look for practice. So yeah, I just wanted to add that on there.
And I'll add, we really appreciate our partnership with Chapin and DCFS to do that hard work. That's how we ensure that there is trust in the technology, that frontline staff trust it, that leadership trusts it. It's because of this work that makes that happen. So thank you very much to everybody, Brian, Christine, Latanya, for participating today. We're out of time. I had a few questions come in from other channels. If you have to leave, go ahead and drop. But if you want to stay on for a few more minutes, there's just a couple more questions that came in through other channels, and I'll start with this one. Does the ability to identify MI techniques across all cases have potential implications for claiming and billing? Maybe Brian, maybe I'll hand that one over to you.
Yeah, the exact mechanism that leads from MI to reimbursements, I can't speak to at this point, but I can say that there is plenty of opportunity, just like as I described earlier, the audit issue. Like the way you prove out claimability is by demonstrating that you've sort of undertaken the prerequisites to be able to claim. And that's not always easy, and caseworkers not always have the time to, for example, make clear that there is an order that reasonable efforts was achieved.
Mhm.
Same thing with MI. Like if you can't demonstrate to the federal government that you did something that allows claiming or in arrears if there's an audit, then that's a problem, right? So this is a way, Augintel is a way to go beyond the regular systems to justify claiming and to identify in the case notes the prerequisites to being able to claim and get federal money. So it has the potential to be and is for Illinois DCFS is actually happening where we're using it to make sure we're maximizing our revenue streams from the federal government.
Mhm. And there's one more question, and this is probably for Christine and Latanya. Um, it's just about the amount of work, right? How much work was involved in training the AI to get good results for detecting MI in case notes, and maybe compare that to what the manual work to do this, to train people to read notes, sort of both how much work was it and how much would it have been if this didn't exist?
Latanya, do you want me to start, or do you have thoughts off the bat?
Yeah, no, you can
Okay,
start.
sure.
Yeah.
Yeah, so that's a great question. And I think actually I'm thinking about it's kind of hard to answer because we're just dealing with two different scales, right? Data at different scales. It's not even possible for um a QA person, a quality assurance person, a researcher, an evaluation specialist to look at this many notes across this many specialists, across this many families. Um, I can say, as Marty mentioned earlier, there isn't really a child welfare specific word bank, or there wasn't, right? A motivational interviewing in child welfare, open source word bank out there to start with. So we provided that upfront documentation. Motivational interviewing, like many evidence-based practices, has a manual. It has fidelity tools. And so those are the types of documentation things you feed the model initially. Um, and and so then it's time on the programming side, which is where Marty and his team come in. So I can't really speak to the amount of time and hours, Marty, that Logan has put into this. Um, but then what happens is we come back every once in a while and we look through examples, right? We always, and Latanya and I carve out time to look at and cross-check case notes and say like, okay, this sentence, this MI tag sentence was pulled from this case note. Do we feel like it is an accurate representation of what was going on in the case note? But to be quite honest, like we couldn't even do that at the scale that this is happening at, right? So I think it's a great question, and I think it really depends. I have done smaller scale, in-depth qualitative work where the number of interviews you're dealing with is 30. And I'm more than happy to hand code, right? 30 interviews and really rich and that sort of thing. Um, so we're just talking about different things here, right? We want to utilize the millions of case notes that contain so much information and to supplement other parts of our data monitoring. And so it's worth it to us in that sense.
And I can say from a general level, we are absolutely able to do things using Augintel that we would never have the human power to do otherwise. Like, period. Like there are questions that would require years of note analysis that we just wouldn't do, right? And with this tool, we can answer questions that were never feasible in the past. And the economics changes on things. For example, we want to understand sort of what percentage of a month we should be able to claim related to QRTP claiming. Before, our data only really ended like at the month, because if you didn't have a full month, our systems were saying it's done. But now we've been able to use the system to like pull out from the case notes like where exactly in the month the child left the QRTB, so we can maximize our claiming potential. So it's just to illustrate, it is like an incredibly sophisticated, reliable workforce to answer very detailed questions that we have. So to your point, Marty, it allows us to do things that we just couldn't otherwise do.
Yeah, I wanted to ditto that because I think about the number of staff that we're starting with currently, which is a little under 600. And that's 600 individuals who's actually putting information into a system currently. And we need to dig down to see their use of MI because the entire state, must be trained in MI and use motivational interviewing to improve our engagement with families, correct? So with that being said, what we're going to find is how can, let's just say one supervisor with a number of 6 people dig into possibly 300-400 notes a month. Because you're saying, hey, one caseworker can have every bit of maybe 14 to 15 families that they're servicing, which means that that's not just one case note per family, right? But when you have a system like Augintel, you can look for MI notes for your entire team and they come up quickly, right? You can look up MI notes for one person and they come up quickly. So to do a qualitative dive using a system like Augintel can get you straight to the point way quicker than it could in the past. And I'm speaking from experience and then from what I can see just from using Augintel myself.
Well, I think that wraps it up. Thank you, Brian, Christine, Latanya, to your organizations, DCFS, Chapin, to APHSA as well. This was a wonderful conversation today. This video will be sent out to all registrants, and I think it'll be posted on YouTube as well. But feel free to reach out to us and continue the conversation. Thank you, everybody, and have a lovely afternoon.